Hey guys, Value-Based Michael here. I'm a huge fan of the advisory board. They do a good job of describing healthcare trends to healthcare executives for them to be able to better run their practices, hospitals, groups, etc. They recently released an infographic talking about 4 different healthcare trends that are up in the air right now that could determine the fate of 2021 when it comes to what happens in the healthcare space. Now, if you're a follower of mine in the healthcare industry, this is going to make a lot of sense to you. For those who aren't, it's good to be able to understand what we're trying to do to be able to fix the system that we feel is broken. Obviously, the cost of gross domestic product has continued to rise. Now, there obviously is the Medicare for All solution, the socialized medicine, and then there is I think what we're all trying to focus in on, which is what can we do to be able to tweak the system or make some major changes to be able to forever change the trajectory we're going on. Now, when it comes to this trajectory, a couple different ways that this can happen. I think when it comes to the root cause, we're looking at fee-for-service, and I think what is not necessarily keeping people away from the hospital. And I think ultimately our goal is to keep people out of the hospital, and those hospital costs being some of the highest for those payers. So what if we saw an emergence of this first trend, which is independent medical groups emerging? So in this scenario, you have some type of payer or third party who is investing in providing attention, resources, whatever it might be, to physicians to break away from their hospital employer. And we could debate about whether it gets into some type of regional physician-owned medical groups or national practice companies, or even still employed but going through some type of national medical group franchise. But regardless of what it looks like or the model there, they are in an all shared risk. So essentially getting away from fee-for-service, being able to negotiate with those private payers, companies, whoever it might be, and be able to enter risk-type contracts. So from that perspective, that's the thought process, and we're seeing a lot more of it. We're not seeing it left and right, but a good example would be Tryon Medical in Charlotte, North Carolina. Just I think 4 or 5 years ago, broke away from the hospital, and now up to 200 or 300 physician groups. So they're growing. They're definitely expanding, but we're not seeing as many as we thought we would by now. Now, I think what advisory board does a really good job of is trying to anticipate what investors are thinking. So they're sitting on the sideline, and just like how we've seen the stock market go up and down so far this year, we do see a lot of investors in the healthcare space sitting on the sidelines watching to see who emerges. There's a lot of insecurity when it comes to the sustainability for these practice groups. One being is you have a lot of these billable elective services that people are waiting on. And then also just patients just generally just kind of avoiding care sites in general due to COVID-19. Now, what the advisory board does a really good job of is saying there are really 2 key ingredients to be able to help to see who emerges, to see who is the one that survives this crazy year that we have. And those are the people that are able to focus in on ingredient A, which is chronic disease management, and ingredient B, which is primary care access. If somebody can be able to manage both of those at scale, the advisory board is talking about them being the ones that are surviving and be able to attract attention from investors. So massive there. If you're running any type of healthcare organization, focusing in on chronic disease management and primary care access is the key to your success. Now, in kind of this theme of cards and poker, the advisory board kind of takes a signs of a winning hand. They really talk about 4 different things. One being is they're able to have a vision to scale. They're essentially saying that if whatever you're doing, if it's just on a small basis, you're not going to be able to make a major change. It does need major payer involvement. It does need to be able to scale. 2, you need leadership who is ready to get a provider base invested into a true at-risk contract and be able to get away from fee-for-service and have that leadership to be able to manage that vision ongoing. There also could be some help from outside sources. So they're talking about lawmakers getting involved to be able to repeal some of the CON, so that certificate of need. So I think when we think of that, whether you're a healthcare industry person or just a layman on the street, you might be familiar with ambulatory surgery centers. They essentially have been created just like anytime that you see any type of involvement of something outside of the traditional model, you're seeing innovation. So I think a lot of people traditionally over the last couple decades, you get hurt, you have a surgery, you have to go to a certificate of need location, most likely a hospital or someplace. And I think originally they were created for good. They were created so that there were hospitals and places that there normally wouldn't be. However, unfortunately, it's been taken advantage of, or just to be to talk about it lightly. But there's a lot of need, a lot of opportunity for us to be able to have ambulatory surgery centers, to have other places to be able to provide that type of care outside of the hospital. And I think when you see those type of innovation, you also see lowering of cost. You also see a much risk focus when it comes to those physicians and how they want to be able to provide those services. And then finally are those practices who are able to invest in infrastructure to be able to scale, and then also infrastructure when it comes to population health. I personally love that last one, being able to have infrastructure set up to be able to risk stratify, to be able to understand how to impact those patients and be able to do outreach. And that's kind of where it goes back to those two ingredients, right? That comes down to that chronic disease management and that primary care access. When you have those combined with scale and population health, I think you have a solution that could win. Now, and finally, wrapping up, we all lose if this happens. So it talks about, let's say these physicians, they get the power they want, they get the funding they want, but unfortunately, if for some reason they get all the things that they need, but they aren't integrated, then we're just going to repeat history. We're going to essentially continue to have just a reincarnated version of what we have with hospitals. So, you essentially need you need to be able to have meaningful reduction in that healthcare cost and those spends. And that can only be done when it's at scale, when it's fully integrated, and when you are focused in on those two ingredients, chronic disease management and primary care access. So there you go. That's trend number one. A lot to break down there, but I thought that was fun. I thought that might be helpful for those who may or may not be in the healthcare industry. I'll be breaking down trend 2, 3, and 4 here probably next week. But if I don't talk to you, have a great weekend, and I'll be having some fun with you over the coming weeks.